Dzień dobry. W ramach działalności Polskiego Stowarzyszenia Ajurwedy Prana kontynuujemy cykl spotkań o odporności. Temat odporności jest aktualny bez względu na porę roku. Najczęściej jednak obniżona odporność daje o sobie znać w okresach przejściowych, na przełomie jesieni i zimy oraz zimy i wiosny. To najczęściej wtedy sięgamy po witaminy i inne środki w nadziei uchronić się przed wirusami, zapominając o tym, że odporności nie da się zbudować w jeden dzień. Dziś w rozmowie na temat odporności bierzemy pod lupę wirusy. Nazywam się Wita Kozubal i reprezentuję Polskie Stowarzyszenie Ajurwedy Prana, w imieniu którego przedstawiam naszego dzisiejszego gościa. Jest nim doktor Ajurwedy Prathameshem Karpe, praktykujący chirurg, wykładowca w Ajurwedyjskim Koledżu i Centrum Badawczym Gomantak Ajurweda w mieście Shiroda w pięknym stanie Goa w Indiach. Thank you, doctor, for accepting our invitation. Please tell us some words about yourself.
I'm very much thankful to the Prana and to Vita for inviting or giving me this opportunity to present my views regarding Ayurveda in current pandemic and boosting the immunity. I myself am Dr Prathameshem Karpe. I am working as Associate Professor in Department of Shalya Tantra at Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa, India. So basically, Shalya Tantra is one of the branch of Ashtanga Ayurveda. Shalya Tantra, so it includes main surgical procedures, then some parasurgical procedures, management of wound, management of fractures, then removal of foreign bodies. Along with that, some parasurgical procedures, Shara Karma, Shara Sutra, Agni Karma, Sira Vedana. Day-to-day practice, we deal with the various disorders like hemorrhoids. Then Agni Karma, it is a type of thermal cautery that we use in pain management. So these are the various things that we usually teach and learn in the Shalya Tantra. So this is the least undiscovered branch in other parts of the world, only largely practiced in India. Whereas some people across the globe, they practice Agni Karma as well as Sira Vedana also, but Shara Sutra is not practiced. So my future plan is to start this Shara Sutra techniques in other parts of the world, also promote it like other techniques like Shara Karma, Agni Karma in extensive managements of wound, non-healing ulcers, etc. So how I directed or got attracted towards Ayurveda. In my childhood, I was suffering from the bronchial asthma, and that was managed. I mean to say, till date, after starting the Ayurveda, till date, I have never experienced any bronchial asthma episode. So this motivated me in learning the Ayurveda and opting Ayurveda as a career.
Thank you very much. Today we are going to talk about immunity, and we will take viruses on target. I should say I myself happened to catch the most fashionable virus this year, but thanks to following your doctor recommendations, I recovered very, very quickly. Thank you very much for your professional guidelines. And now back to the topic of our meeting. Please tell us more how Ayurveda, being ancient evidence-based medicine, explains and treats viruses.
Before going with the questions that you have asked, I will just brief what is Ayurveda. Two words, that is Ayu and the Veda. Ayu is life and Veda means knowledge. So Ayurveda explains the things regarding the life, what are good for the life and what are bad things for the life, how to live the healthy life, how to prevent the disease. To understand the disease, we should know what is health. Defines health as a in Sushruta, this definition is given as Samadosha Samagnisha Samadhatu Malakriya Prasanna Atma Indriya Mana Swastam Ityavi Diyate. It is a state of or balanced state of dosha, dhatu, mala and pleasant state of
Atma, Indriya and Mana. Okay, so disease will be opposite to this. How we understand the COVID? So as modern medicine, it identifies disease in terms of infectious disease in terms of infectious agents like bacteria, fungus, virus, protozoas, etc. Ayurveda identifies any disease in terms of imbalances between the dosh, dhatu and mala. Ayurveda aims in treating the host and not uh, giving primarily focus to the infective agents. We treat the host, understanding the COVID. The COVID, also known as coronavirus infectious disease, we need to understand two different things. When person gets positive, one is corona positive and one is COVID-19 disease. Corona positive refers to the person who has been identified as corona positive by various diagnostic tests like rapid antigen or PCR, that is reverse transcriptase PCR by taking the swabs or by other means diagnostic criteria, but has not developed any symptoms, what we call as asymptomatic. For that patient, we do not label him as a COVID-19. That patient or that person who is positive is just a corona positive or SARS positive for SARS-CoV-2 positive, that is severe acute respiratory syndrome coronavirus 2 positive for this virus, also known as beta coronavirus. It is caused by corona disease or COVID is caused by this virus. It is a single stranded DNA. It primarily targets the respiratory system. Transmission from symptomatic and asymptomatic patient by direct contact. Droplets range is 1 to 2 meters and formites up to 4 hours on copper surfaces, up to 24 hours on cardboard, and up to 2 to 3 days on a plastic and stainless steel surfaces. Formites are the virus that is present in inactive form outside the body. Incubation period refers to the 2 to 14 days. Affects all genders equally. Average age is 47 years. Symptoms includes, initially they included very few symptoms. Now if you see current research, it includes symptoms not only pertaining to the respiratory system but also to the gastrointestinal system, central nervous system or peripheral nervous system, then cardiovascular system and all other organs. So primary symptoms include fever, dry cough, sore throat, shortness of breath, diarrhea, body ache. Disease may progress into pneumonia, leading to the acute respiratory distress, and if not, then person may die. Then other symptoms, mild symptoms include loss of taste and smell. Then some other complications can be vasculitis, coagulopathies. Deaths are taking place because of this coagulopathies, blood get clotted. And recently that is discovered in children especially who are affected with this virus, multi-organ inflammatory syndrome. So disease according to Ayurveda we identify in terms of abnormality in the functioning of dosh, dhatu and mala. Then status of the agni in disease, it is impaired metabolism or agni mandya will be there, and kavaigunya, that is legends will be in the srotas. If you have come in contact with a positive patient or you are asymptomatic, then no need to worry. First thing, in any stage or anything, whenever you get fall, or not only COVID-19 but in any disease, first of all, don't panic at all. Disease is the having fever is a good sign because your immune system is acting towards it. Now when you get fever, don't first thing to do is don't suppress that body's immune response. Never suppress this body's immune system. When you develop a fever, that means your immune system is fighting. Your soldier cells or your defense cells mechanism, that is your WBC, white blood corpuscles, they are fighting with the infection or intruder who has entered in your body. It can be anything, not only coronavirus, but any other virus, any fungus, any bacteria, any pathogens, any other biological, non-biological entity that has entered into the body. Body is trying to get away from the disease, means your body is fighting against it. Now, being an intelligent creature on this earth, so-called intelligent creature on this earth, Ayurveda helps in natural resolution of this inflammation. How to resolve the fever naturally. So what to do now? When disease will take place when there is a Agni Mandya. So how to improve the Agni? First of all, drink sips of hot water. I repeat, drink sips of hot water. Don't drink glasses or bottles of hot water. Sometimes when fever is there, you will, because of dehydration, one will experience excessive thirst. Okay, in Ayurveda, this thirst is explained not due to absolute dehydration, but it is due to presence of ama. This ama blocks the srotas, and this blocking of srotas, as we discussed, that ama, presence of ama in the body, it affects the udak srotas. So this improving the metabolism and digesting this ama will clear the srotas, and it will help in proper regulation of fluid dynamics in your body. So drink sips of tea. Never go for the ice sips of water or cold water. Whenever you get fever or whenever you feel ill, don't go for the chilled water. Only exception is there if you are feeling thirsty due to overexertion or after coming from the or after exposure to the sunstroke, or after developing the sunstroke, or after consumption of alcohol or any hot substances. If you feel thirsty, then have room temperature water. This is the exception for hot water or in summer season. Whereas in other condition or other seasons, always drink sips of hot water, irrespective of any age. Second thing, if you are having a fever or you have developed mild symptoms, drink the water that is processed with the bitter herbs. So classical example is the guduchi or Tinospora cordifolia. So this guduchi we recommend for this pachana or improving the metabolism. So this we advocate or advises to the patients of COVID-19 or who have been diagnosed as COVID-19. So why to use this bitter substance? In Ayurveda, the bitter substance or bitter tasting substance or this bitter taste is known as Tikta Rasa. The Tikta Rasa is made of dominant in Akasha Mahabhut and Vayu Mahabhut. So this helps in metabolism of ama. It helps in getting rid of the srotas or channels that are clogged by this kapha or ama. So this helps in clearing the srotas. And also guduchi is a tridosha gana, and it is also having a rasayana property. So it restores the abnormal increase of vata, pitta and kapha, and also rasayana. So that means it is a immunomodulant also. Langana, now in the Western world, this Langana also, this is identified as intermittent fasting or fasting. So in Ayurveda, there are 10 types of Langana is mentioned. So this includes 4 types of Panchakarma processes. Now in fever or in fever-like disease, it is clearly mentioned that Langana to be practiced is the Upavasa. Upavasa means not eating the food till you feel hungry. Not eating the food till you feel hungry. So you should wait. You shouldn't consume even a single bolus or single small amount of grain also if you are not feeling the. That is called as Upavasa. Now this can be modified according to the patient. For if patient is old, like above 60-70 years, who is emaciated, for them Upavasa is not advised. For them mild hunger is there, then some lagu ahar or food that is easy to digest, that is indicated. Like it is mentioned in the point number 3, rice gruel, green gram soup, vegetable soup, khichdi or meat soup. Okay, this can be advised to them. Then pachana, use of tikta rasa dravyas or bitter tasting substances to enhance the metabolism. And keeping the body warm by use of heavy clothes. So if you are having a fever, don't sit under the fan or in the air conditioned room. Wear warm clothes and induce the sweating. Sweating should be induced without sitting in the sauna baths or in the steam box. This sweating is to be induced only by the wearing the warm clothes or heavy clothes or covering the body with the blanket and all. So this will help in inducing the sweating. Now what will happen when sweating is induced? In fever or fever-like condition, that is in Jwara, srotas are clogged by the ama. So this helps sweating, inducing the sweating, it clears the rasava srotas. Okay, it clears the srotas and thus it enhances the metabolism. It helps in enhancing the obstructed srotas, thus enhancing the movement of doshas. And thus drains of the toxins from the body. What things to be avoided? Avoid eating and drinking without appetite and thirst. So observe your natural urge of thirst and appetite. Avoid daytime sleep after meals. Okay, avoid taking a nap after meals. Exception is only for the old age or those who are emaciated, those who have become lean and thin because of chronic illness. For them, this exception is there. Otherwise, for the individuals like you and me, sleeping after day meals is contraindicated, especially in presence of fever or fever-like condition or breathlessness. Sleeping after daytime is contraindicated, and staying awake at night is contraindicated. Avoid dairy items, fermented and sour tasting foods, astringent foods, bakery items, and fruits and dry fruits. Use of oil, ghee, and other fats, butter, fruit jam in the food should be avoided. Suppression of natural urges like micturition, defecation, hunger, thirst, flutters, sneeze, cough. This what we call as adharaniya. This should be avoided in any disease condition, not only in fever but in any disease condition or by the healthy individuals also. And use of air conditioned room, sponging the body with cold water, application of oil, balm, or any kind of labor in acute fever, that is Taruna Jwara, that is fever less than 7 days or less than a week. During this condition, one shouldn't apply any kind of labor or any kind of oil, balm, lotions. Guidelines for boosting the immunity. Now, what guidelines do this is to be practiced by the healthy individuals and not by the person who has been emaciated with the disease. After improving the strength of that emaciated person, he can be advised for this Dinacharya guideline. So, waking up early before sunrise, practicing the exercise like Surya Namaskar or doing sit-ups or even doing the gym is good. Here, Vyayama in Ayurveda is described as one that does by stretching up the body, which helps in vigorous movement of exercise in a proper way, and this helps in metabolism, improving the metabolism. Sleeping early at night, eating meals as per the appetite, means once appetite is there, eating the meals at that time. Some breathing exercise like pranayam, anulom vilom, bastrika, kapalbhati can be practiced to improve the airflow or improving the ventilation. Abhyanga, oil massage, full body by self massaging before bath is advised in Dinacharya, but Abhyanga is to be strictly avoided in the person who are having inflammation in the body or who are having ama in the body or who are suffering from the indigestion. For them, Abhyanga is to be contraindicated, not to be done. And having a bath twice a day, morning and the evening. Having bath after digestion of meals or before meals. This is the timing for the having bath. So those who are having fever, active fever is there or breathlessness is there, for them having bath is contraindicated and sponging is contraindicated as per the Ayurveda. And having a bath will help in cleaning your body. So having bath also, it stimulates the metabolism and it relieves the fatigueness and improves the circulation. So Ayurveda view on prevention of transmission of disease. Now this verse of this shloka is explaining Sushruta Samhita. What does it explain? The sutra says Prasangat Gatra Sanskarshat Nishvasat Sah Bhojanat Sah Shaya Asanaschapi Vastra Mala Anulepanat Kushtam Jvarasya Soshasya Netrabhishanda Evacha Upasargika Rogasya Sankramati Narandram. Now some people, they argue with us that in Ayurveda infection or communicable disease are not explained. Some skin disease, fever, tuberculosis and conjunctivitis like condition is spread by following activities like repeated contact with the infected person. That is a Gatra Swamsa. Gatra is a synonym for body. Swamsparsha, touching to it. Nishvasat is a exposure to the breath. So there is a droplets. Saha Bhojanat. So dining or eating together with the infected person. Sahashaya Shapi means sleeping with the infected person. Exchange of Vastra, that is clothes. Mala, that is ornaments. And Anulipana, using the body lotions or lap that is used by the infected person. This will help in spreading the infected condition from one infected person to the healthy person. Then one guideline given in Ashtanga Hridaya Sutrastan in second chapter. This is a chapter that explains the Dinacharya. What does it say in prevention of this communicable disease? न असंवृत्त मुखा कुर्यात् श्रुतिहास्य विजृंभणम नासिकां न विकुष्णीयात् अकस्मात् विलिखेत बुहम. Covering the mouth with hand cloth during yawning, sneezing and laughing, and avoiding the scraping of the nose or nose pricking, or avoiding the repeated scraping of throat, mouth, ear, like these orifices with the hands should be avoided. This will help in preventing the prevention of this communicable infections which are spread by droplets. Even the research about the coronavirus says that affection of disease is more towards the when you touch your eyes, nose or ear, mouth, and this touch part like hand, if you touch it somewhere, then these fomites will be transmitted from infected to the this clean surface. And if some other persons come and touches that object, that fomites will be touching to his hands or body parts, and they are again he touches his own nose, ears, rubs his ears or mouth, then these fomites will be transmitted, will enter in the body to this ear, nose, throat and eyes. So these habits are explained in our classics, which are thousands of years ago. So this helps in this as that epidemics were present or pandemics were present even in early period also. These are not recent. And they have mentioned very well preventive guidelines if we advocate in our day-to-today's life. So this can be spread of epidemics or this virus can be prevented. So use of face shields and face masks also serves the above purpose. So why not to use masks and face shields when you are going in the crowded places? Thank you. This was about the COVID understanding of COVID-19 in how to improve the immunity in presence of this current pandemic, and these were the general guidelines. Thank you very much.
Thank you, Doctor, for the valuable information which you gave in your presentation. Please tell us what is the rule of preventing the pandemic according to Ayurveda?
When we call a pandemic, when one certain infection which spreads across the part of the globe, then we refer to as a pandemic. This pandemic is not new in Ayurveda. In ancient times also, various types of pandemics are mentioned in Ayurveda. Microbe or pandemic disease caused by microbes, but also by toxicity created in the air, in the land, in the water, in the surrounding this thing, I mean in forest or in the trees. So how population at a large scale can be targeted or destroyed and how to manage them. So these are very well mentioned in even in Sushruta Samhita also, in chapter like Yukta Adhyaya and all. There how to test the water whether it has been poisoned by the enemies, or how to check the air quality whether it is intoxicated or various poisonous gases are there, or whether land has been contaminated by the poison or not, or food has been contaminated by the poison or not. So this pandemics is not new to Ayurveda. It is already mentioned in Ayurveda. Then how to deal with this pandemic? Ayurveda doesn't target whether that infection is caused by this organism, whether it is a virus, whether it is bacteria or fungus or something like that. Ayurveda identifies the disease, how it is, what trouble or what changes it has made into the host. Because finally, so Ayurveda, while treating any infection, it doesn't emphasizes or stresses only on identifying the which microbe has caused that infection. Rather, it focuses on the host mechanism. It's in its ability of the host to fight that infection. So basically, we identify which doshas are whether the doshas are, which dosha is increased or which dosha is decreased. That is chaya or what we call vriddhi or kshaya or prakopa. With that, we identify the doshas and we plan the management accordingly. So whether it is a COVID-19 or H1 influenza or Middle East respiratory syndrome or any other pandemic is there, any other viral or other other bacterial disease is there, we won't think in terms of like this XYZ herbs is having antiviral, antibacterial, or antiprotozoal activity. We will see which dosha is increased in that person, or which dhatus are affected. So like that, we will identify the pathogenesis, that is samprapti, and accordingly we will plan the therapeutics, what we refer to as Bheshaja karma. So accordingly, that Bheshaja karma will be planned, and its internal environment of the host will be restored. So it can be in terms of advising or designing the pathya, that is pathya means proper or nutrition, or that lifestyle regimen according to that stage of the disease, followed by the after once doshas are restored and Agni status or metabolism status is restored, then we go for the Rasayana Chikitsa. Rasayana refers to the in developing the immunity, so or developing the dhatus. So this is the a style of Ayurveda, I will say, in combating the pandemics. So whatever pandemic is there in future, many pandemics may come. So no need to worry. Incorporate Ayurveda in terms of Dinacharya, Rutucharya. Consult a qualified Ayurvedic physician. Don't go for the internet remedies or online remedies or self-medication, calling it as a herbal, it will be safe. I will stress on this fact that Ayurveda also doesn't mention that all the drugs are safe until or unless they are given in intended or indicated condition. If a person takes a cold water in painful joints also, it will affect the vata and it may aggravate the joints. So this is the side effect of that water. So similarly, if any drugs or any herb is taken without any indication, then definitely it will cause some adverse effect. So better you consult qualified Ayurvedic physician in your town or in your vicinity. Take advice from the Ayurveda physician and follow up with your disease with that Ayurveda physician, and incorporate or adopt the Dinacharya and Rutucharya seasonal regimen. There is a Rutucharya, Dinacharya daily regimen in terms of diet as well as daily regimen. Practice Surya Namaskar like exercises. So this will help in building your immunity. Just taking mere some herbal teas or something won't improve your immunity. So this is my message to all the people who are listening. Not to fear or not to get panic. Your nature has given a good immune system to you. So Ayurveda will help in boosting your immune system. So consult a qualified Ayurveda physician and take the proper advice from that physician and use the Ayurveda wisely. Thank you.
Thank you very much, Doctor, for your time. And we are looking forward to further meetings when you will share your knowledge and the wisdom of Ayurveda. Thank you.